This is the axial system, skull, vertebral column, then this caudal vertebrae, which has on average 20 vertebrae, 18 to 20 vertebrae in most dogs, okay? That's not to say, so you're like, wait, I don't see dogs with like tails that long. Okay, why is that? They knock them, cut them off. Why? I have no idea, okay? Okay, same with the ears, you know, you'll see floppy ears, and that's what they're born with. So, you will see in dogs and different breeds that they have different structures. This is what we call a dolichocephalic dog. In your manual, you will see there's 3 types. So you have dolichocephalic, which are going to be like your boyzois, your greyhounds, you know, your collies. Okay, the longer body, the longer head. Then you're going to have your mesocephalic, which are going to be most of your breed dogs, you know, your labs, your, you know, dobies, your, you know, just basically all of the other middle breed dogs. And then you're going to have the brachiocephalic, and those are going to be your dogs that are what? Okay, the flat faces. So we're going to go from elongated skull here to meso, which is that kind of normal range, to your brachiocephalic, which means almost like no face at all. It's just kind of like a square face. Okay, and then you will see, besides that, that there will be some dogs that they don't have long backs, but they have very what? Short legs. And what has happened with these dogs, and it's called achondroplasia, through the years, their growth plates basically have trashed, and so they inbreed their legs so that they don't keep elongating. So you will. So what dogs are though? Your corgis, your Dachshunds, your Basset Hounds. Okay. So when we look at these structures, we're like, why bring this up? Well, number one, sometimes it can give you an indication, because this is your structural framework, what kind of orthopedic, ortho meaning bone, issues can be happening because of just the genetic structure of the dog. What can be happening in their gait or any other physiological function because of their structural formation. Okay, if you think about balance and physics, okay, if it's even, it's going to be more structurally sound, right? So you know from the structure, some dogs are going to have more injuries because of this, this, and this, okay? So again, axial skeleton, skull, vertebral column, caudal vertebrae. As you can see, attached to the spine are the ribs, okay? And then they come out, and they come down here and attach to the sternum, okay? Here you have the manubrium, which is the first sternal vertebrae. And then see all these separate sternobrae, we call it, makes up the sternum. At the end, we have the xiphoid and the xiphoid process. Appendicular. Here it looks like it's attached, but it's in the dog, it's not. What we want as therapists is to work around the scapula so that you get nice scapular movement. Okay, and all these muscles that we're going to talk about cover, and if the muscle goes from here to here to here to here, or within here, okay, does not go outside of these structures here, that's called an intrinsic muscle of the thoracic limb. Thoracic limb, okay? If the muscle goes from here to here, or here to here, or here to here, crossing these joints, here to here, okay, that's an intrinsic muscle of the thoracic limb. If the muscle, say, goes from here to here, now this muscle crosses outside, it's not within this limb, that's an extrinsic muscle of the thoracic limb, which basically, it connects anywhere on the thoracic limb, but outside of it. So, might be the brachiocephalicus, which attaches here, okay, and the head. It might be the transversalis, which attaches here to here, okay. So, go ahead.
Does the origin have to be on the thoracic limb for it to be?
No, it could be either or.
Okay.
Okay, so the origin can be transversalis, to connect here. Actually, that's a dual one, origin insertion switches.
Oh, okay.
Let's say the brachiocephalicus, which actually that's a dual one too, attaches here, here. If this is stable and this is the origin, it'll pull down this way, so it'll pull the head down. If this is stable and pulls up, you'll get extension of the shoulder.
Okay, gotcha.
So know that in the thoracic limb, if you just remember this, you'll know. Scapula, humerus, radius, ulna, carpals, metacarpals, phalanges. I know if any of these structures, the muscle attaches within it, that's an intrinsic. All right, we're going to go to the pelvic limb, which basically is the pelvic girdle, and there's 3 bones that make up that. Femur and all the rest down here. If it's intrinsic, that means it attaches, say, from here to here, or here to here, here to here, here to here, right? If it comes off of this limb and attaches from the pelvic girdle, okay, say to the spine, okay, or from here to here, as in the iliopsoas muscle, that's an extrinsic muscle of the pelvic limb. Okay? Okay, because this is the pelvic. All right, so it's easy. All these muscles that go up and down the spine, these are all intrinsic muscles of the axial system, right? Because they all attach within themselves. But, so you can say the opposite, right? It could be intrinsic of the axial, but then when it crosses, it's extrinsic of the axial and extrinsic of the thoracic. Okay, so 2 major components, systems of the skeletal system. Axial and then appendicular. Thoracic limb, pelvic limb. So now we're just going to go through major bones. So let's start with the skull. So there's a lot of different components of the skull, but we're basically going to break it down into the different parts of the skull that protect the brain. And there are different components. We call these flat bones, and they're held together by sutures. The frontal area will be the frontal. Okay. Your side area here will be the parietal.
Oh, parietal.
And then right back here, where you feel your temple, will be the temporal bone. And then back here where the occipital ridge is, and you need to know that bony landmark because all these back extension muscles in the neck come and attach on the back of the skull here. If you guys go like this, you can feel that ridge. Okay? That's your occipital ridge. Okay? Everyone just poke in there and you go, whoa, that's tender. Okay? So when you have major muscles that insert in major landmarks and you push on that, it's going to be really tender on the dog. Okay? Because it constantly has that tension on it, right? So, occipital ridge. So that's the skull. And then we have the maxilla and this is a big one, the mandible, which is this entire lower jaw area here. Zygomatic arch. Okay? Okay. So, here's your head, skull, and these major bones. From here we have the vertebral column. The first 7 vertebrae make up the neck or the cervical vertebrae. Okay? C1, C2, C3, C4, C5, C6, C7. Okay? Major articulating bones you need to know are the first and second vertebrae. The first one is the atlas. Atlas. Okay? The second one is the axis, which the atlas moves around on what we call a pons. Think of the first vertebrae. This is the world, and this is the Greek god Atlas, and the world is sitting on Atlas's shoulders. Okay, that's how you remember, and don't get these confused. Axis is the one that Atlas turns on. So this is where you get what? Rotation of the head. So your movement is actually at C1, C2, not here. You have strong ligaments in here, and this is the movement you get between the skull and the atlas. Just this little movement like that. Okay? Keeps the head from falling off the atlas too. Okay? And then you have all these strong muscles that keep the head up or extend the neck and head. Next you have 13, anyone, what's that area we called here earlier? Thoracic. So we have 13 thoracic vertebrae along with 13 ribs. Okay? So always know the ribs are going to be aligned with 13 thoracic vertebrae. In the dog, the dog has 9 true ribs. So the 9 ribs come in and attach on the sternum, okay? The next 3 ribs come down and attach on costal cartilage, which kind of comes into this last rib and then attaches to the sternum. And then you have a very last one called we have it too, floating rib. Okay, so it's just out there in space. Then we have 7 lumbar vertebrae. Okay, and then we're going to have 3 little vertebrae here, which are actually fused to make up the sacrum. So if everybody goes like this, you go to the bottom of your spine and you feel that flat bone right there. That's your sacrum. Okay, so there are 3 fused vertebrae. And then on us, what do we have here? Like a little tailbone, right? Well, that's the tail on the dog. But on us, it's just
evolved
this little,
off.
Yeah, basically. Because we don't use it like they use it. What do they use their tails for?
Balance.
Exactly, balance and steering. Okay? Okay, so now I have the caudal vertebrae, which can be anywhere from 1 or 2 to 20, depending if the dog had that. But anatomically at birth, 18 to 20 caudal vertebrae. This is, anyone to tell me? Scapula. Many people will call it the shoulder blade or shoulder girdle. Know it as the scapula. This is the spine of the scapula. This is an important landmark to know because major muscle sits below it and above it and attaches on it, and we'll go over that with major muscles. The long arm of the upper arm, this bone is called the humerus, okay, which articulates with the lower arm bone, the ulna, and sitting next to the ulna is the radius. The radius in anatomical position is always going to be the one in front and medial, okay? It's a teeny bit thicker. The ulna is the longer one, and this is where it articulates this is the olecranon fossa. The olecranon process fits into that fossa. So this is where you get that hinge movement. Okay? For today, just know what?
Scapula,
humerus,
radius, ulna.
Perfect. Then we have the wrist joint, okay? We can call it the radial carpal bone if you like. We can call it, but what I want you guys to know is that these little tiny bones, like in our hand here, are called the carpal bones, okay? They're little, what we call irregular bones, okay? And they sit just below the radius and ulna, and then beyond that is called the metacarpals, which are long bones, okay? So if you feel on your hand, you go over, you feel these long bones here. Up here, you feel kind of just a big mess, okay? Just all bunched together. And then you have your metacarpals. Meta means beyond, and then you have phalanges. Phalanges are your fingers or your digits. Those are broken down from proximal, middle, distal. Proximal means closest to the trunk. Distal means away from the trunk. Okay? So I will say my phalanges is distal to my metacarpals. My metacarpals are proximal to my phalanges. You get it? My humerus is proximal to my radius. Got it? So no one proximal and then distal. My distal tail would be furthest away from the trunk, right? Okay? All right, so that's the thoracic limb. Look, you got through the thoracic limb already. Then we're going to go to the pelvic limb. And here we have the pelvic girdle or the pelvis, which is made up of 3 bones. Know them. Okay? The front part here is called the ilium. Everybody? Ilium. So when you go on the dog and you feel that ridge, if you guys all go like this, you feel that ridge around there? That's your iliac crest. This is a great way to find on the dog, unless they have way too much adipose tissue, it's hard. But if you go deep enough, you'll feel this ridge and you'll follow it back till you can't go anymore. It kind of stops right here, and then you have all this muscle tissue. Then you know you're at the lumbar sacral joint. Okay? What's going to happen is you're going to find ways to know where you're at, just like where the thoracic vertebrae meets the lumbar. You take the last rib like you would on you, kind of wrap it, I'm outlining it, it curves, and now I'm at the thoracic lumbar junction. So on the dog, I go down here, oh, here's the last rib, I follow it up, it curves, oh, I'm at the thoracic lumbar junction. Okay, that's a lot easier than going 1, 2, 3, 4, 5, 6, 7. Where am I at? Right? You just will intuitively start knowing where you're at on the dog. Okay, so pelvic girdle. I know that this front bone is the ilium. Okay, then there's a seam here, and then this is the back part. On this side is the ischium. Ischium. Say it. Ischium. This is the ilium. And then this front bone in the middle here is the pubic bone. Okay, so it's the same on both sides, right? But it's joined here in the middle by what we call the pubic symphysis. And a symphysis is what? Does anyone know, like, the meaning behind it? It's a joint or a joining of, symphysis, coming together. Okay, and that's cartilage. Okay? This major bone, and this is a really cool joint, I love it, the coxofemoral joint, and it's basically where the femur articulates with the hip. So this is your hip joint here. So, see this protrusion here? You gotta know this. This is the greater trochanter of the femur. This is the femur. Your hip joint is right here. If you find the greater trochanter and go medial, you're gonna hit that joint. This is a ball and socket joint. So if I were to pull out the femur, you're gonna see that there's like a ball that sits medial and on top of this bone. Ball and socket joint. So what happens is these three bones, pelvic bones, meet together, okay, and they form this socket, and that socket is called the acetabulum. So what's this bone called?
Femur.
Femur. Okay, it's the biggest, strongest bone in the body. So we have the femur, which articulates directly with the tibia, and this is the thicker bone in front, and then the fibula is the little one that rides laterally, medial towards the midline, lateral, away from the midline. This is called the patella. Okay, this is strictly just to have this little, it's not as big as our kneecap, which is really big and flat. Okay, it's really small on the dog, and it's embedded in what we call the patella tendon. We have the quadricep muscles here, there's 4 of them. They turn into this really thick tendon that attaches here, and that's the muscle that does this, really powerful knee extension or stifle extension. So that patella kind of just rides under. The patella is on the stifle, in front, in between the femur and the tibia here. Okay, so then we're going to go down to where the tibia and the fibula meet the tarsus. These are your tarsal bones. This big one back here is the calcanei, or what we might consider the hock. Okay? We have actually 5 muscles that come down on us. We know our gastroc attaches to our heel. That's the Achilles tendon. On the dog, there's actually 5 muscles that come down and turn into this big fascial band called the Achilles tendon. But the primary muscle is the gastroc on the dog, too. Anyway, so we have the tarsals. We have the longer ones underneath are going to be called the metatarsals. And then we have the phalanges that are distal to the metatarsals.